Hi, welcome to Chapter 11. This is Professor Clemens. Let's talk about the physiology of physical activity. The study of acute or immediate physiological responses to physical activity and the changes in physiological responses to chronic, repeated over time physical activity. Exercise physiologists apply principles of how biology and chemistry to understand how the body responds to physical activity. This serves as the foundation for conditioning, fitness, and rehabilitation programs. Let's talk about the scholarly study of physical activity as it applies to the physiology of physical activity. What does a physiologist of physical activity do? They can be university professors, researchers from the military or NASA, employees of corporate fitness or hospital-based wellness programs, or clinical exercise psychologists employed by hospitals in cardiac rehabilitation programs. Exercise instructors, personal trainers, strength and conditioning professionals, or specializations with a particular population, such as older adults, children, or pulmonary patients. The goals of physiology are to understand how to enhance physical performance, to understand how to improve physical function in particular environments such as high temperature, high altitude, to understand how physical activity and exercise improve health and fitness. The goals of physiology are also to understand how exercise can be used in treating and preventing disease and alleviating symptoms of disease, and to understand adaptations in human anatomy and physiology in response to physical activity. The history. Early beginnings evolved from physiology. These are some names: Antoine Lavoisier, Auguste Crull, A.V. Hill. Early laboratories from 20s to 40s are Harvard Fatigue Lab, Springfield College, and University of Illinois. Significant events: 1950s, Morris Coronary Heart Disease Study in England, ACSM founded. That's American College of Sports Medicine. 1960s, biopsy needle, Mexico City Olympics, Medicine and Science and Sports. 1970s, American College of Sports Medicine Certification Program publications. 1980s, amenorrhea related to low bone density. In 1990s, NIH and Surgeon General reports. The health effects of moderate physical activity are beneficial in reducing the risk of chronic disease, heart disease, diabetes, hypertension, and colon cancer. Health effects of moderate physical activity. Significant research findings linking physical activity and health. You might want to Google these. Physical activity and health, a report of the Surgeon General, NIH website, or the JMA articles. Research methods and physiology of physical activity. Laboratory: ergonometers, treadmills, leg and arm cycles, and swimming flume. Oxygen uptake, gas analyzers. Body composition, underwater weighing, calipers, and DEXA. Biochemical methods: blood samples and muscle biopsies. Animal models, mammals, and that match humans as closely as possible. Can control the subject and environment more easily and specifically. Fieldwork outside the lab. Technological advances have made fieldwork more practical. How physiological systems, cardiovascular, muscular, and respiratory, respond and adapt to physical activity, single and repeated bouts. Factors that influence physiological responses: temperature, diet, and altitude, and the relationship among fitness, activity, and health. Skeletal muscles, muscle fiber types, adaptations to anaerobic and aerobic training to resistance training. Training principles include progressive, overload, and specificity. Cardiovascular system, cardiac output, heart rate and stroke volume, blood flow distribution, cardiorespiratory adaptations to training. The respiratory system regulates exchange of gases, including oxygen between the external environment, air, and the internal environment inside the body. Ventilation increases rapidly at the onset of physical activity and also as a function of exercise intensity. Training can alter the efficiency of the body to move and utilize oxygen. Effects of exercise, effects of acclimatization, effects of increased internal heat related to increased physical activity, and its impact of vasodilation of skin, blood vessels, and sweating. Nutritional effects: carbohydrates intake for optimal performance and health, fluid intake for optimal performance and health, and iron intake for optimal performance and health. Physical activity, fitness, and health: effects of age on fitness, physical activity, fitness, and coronary heart disease, physical activity, and weight control. Here are some recommendations. Improvement in cardiovascular endurance requires 20 to 60 minutes of activity at 70% to 94% of maximum heart rate 3 to 5 days per week. See page 316. And I just want to add here, recent studies have said 30 minutes every single day. So depending on where you're getting your stats from, I think American Council on Exercise recommends every day for at least 30 minutes to be active. Note, greater volumes and intensity of exercise will result in additional health and fitness benefits. Health benefits results from the accumulation of 150 minutes of physical activities in various ways, including 30 minutes 5 days per week or 50 minutes 3 days per week. And refer to page 316 if you want a little bit more information on that. The physiology of physical activity: study and explore acute and chronic adaptations of physical activity for performance, fitness, and health improvements. Cellular and total body physiology: the body's response to physical activity related to a variety of factors, for instance, heat, environment, and altitude, and a variety of career opportunities.